So you walk into your breast augmentation consultation, and the surgeon's going to do most of the talking. But what you don't realize is that the questions you ask will probably have the most significant impact on the results that you get. And they're more important than anything else that probably happens in that room. So you've come in and done your research, you've looked at before and after photos, you maybe even have brought in photos that represent the kind of results that you want to achieve. And that preparation is really important and it definitely matters. But there's a layer underneath the size and shape conversation that really matter, and it's a layer that most women don't actually ever get to in the consultation. This is the layer where the actual differences between surgeons, techniques, and the implants themselves actually live. Across thousands of breast augmentation consultations, the patients who get the best results are not just the ones who come in with the photos, they're the ones who come in with the right questions. There's one specific question that almost no patient asks, and the answer to it tells you more about whether this is the right surgeon for you than probably any of the other questions you're going to ask. It's also more important than any before and after photos that you're probably going to see on their website. I'll get to it before we're done. We're going to go through 8 different questions based on categories. We'll talk about technical questions, safety questions, planning questions, and finally questions about the consultation itself. By the end, you'll have a list that you can bring with you to your consultation. All right, let's start. So the old thinking was implants are implants, pick the size and shape, and the surgeon will determine the rest. There's really no difference. The details are more or less the same wherever you go. But the reality is that implant choice and placement of the implant are 2 of the most important decisions that you're going to make. They can affect the long-term results, complications, immediate postoperative recovery, and they can vary significantly from surgeon to surgeon. Women who've skipped these questions oftentimes end up with results they didn't anticipate. Not because anything went wrong in the operating room or with the surgery itself, but because the plan was never going to be the right plan for their anatomy and for the results that they desired. So these aren't advanced technical questions. They're the first 2 things that you should ask in any consultation, and the answers will tell you a great deal before you go any further. So the first question to ask is, where do you plan to place the implant, and why is that the best choice for my anatomy? The options are over the muscle versus under the muscle, and there's trade-offs for each. For under the muscle techniques, it often requires actually cutting a portion of your pec muscle. It's going to lead to a longer recovery. You can have a kind of lateral or to the side displacement of your implants over time because that pec muscle, when it contracts, is constantly pushing downward and outward pressure on that implant. You can also have what's called an animation deformity, where when you use your pecs and flex, your breasts move in a very unnatural, odd way. You can also end up with something called a waterfall deformity, where your breast tissue droops off of your pec muscle while your implant stays high in the capsule underneath your muscle. If the surgeon responds, "I always do under the muscle," with no explanation of the anatomy or why, it may be worth considering doing some additional research. The second important question that a lot of patients don't ask is, what brand of implants do you use? What are the complication differences with that implant versus the other brands? And why do you choose that specific one? It's important because complication rates vary meaningfully between the different brands. A premium implant with documented safety data is something that your surgeon should be able to clearly explain to you. If they're vague, you're probably not getting the full picture in that consultation. So strong answers to these questions are going to give you a specific implant placement, why that's the right choice for your specific anatomy, what brand of implants that surgeon uses, and why, and what the complication rates from those implants are. If the surgeon gives you kind of vague or generic answers, you really need to kind of push deeper with your questions. So implant placement and brand establish a technical foundation. The next 2 go into safety and fit. This is where a lot of consultations fall a little bit short. A lot of people think that complication risk is solely dependent on the surgical expertise of the surgeon doing the procedure. Better surgeons, going to be lower risk of complications. Beyond that, they think it's mostly just luck. The error in this is that complication risk is shaped by 3 different factors. Surgical technique is obviously very important, but also what type of implant and brand do you choose, as well as where you place it, have demonstrated differences in complication risk. Asking only about the surgeon without asking about the combination of the other elements is leaving a really big gap in that assessment. So capsular contracture, which is when scar tissue forms around the implant in an excessive fashion, is really one of the most important and significant complications that we worry about as plastic surgeons. It's not a random event. The rate and risk that you're exposed to depends on specific choices that are being made as far as which implants and where they're placed. So you don't really need to know every technical aspect to understand the right questions. You just need to know what the combination of all of those risk factors leads to for your overall risk with that implant. So the third question to ask the surgeon is, what is your capsular contracture rate with the implants and the placement that you're suggesting doing in me? So this is going to give you a little bit more of a specific answer as far as your personal risk rather than just a generic answer. And one of the important distinctions is that the smooth surface implants on Motiva implants, for example, in over the muscle, under the fascia placement in 5-year data has shown a capsular contracture rate that's 0.5%. That is considerably less than any capsular contracture rate documented by any other brand manufacturers. That is a documented rate and it's published. They should be able to share that with you. And if they aren't, again, you should be asking some additional questions. Question 4 is a really important one. And that's, how do you determine what the right implant size is for me? And is there a way for me to visualize it and see it in my body before making a final decision? So there's really kind of two different approaches. You can have a standard approach where you just give the patient a range of sizes. They may try on some implants and a bra and then pick the one they like, versus a structured assessment that's going to look at what their chest wall width is, what the breast base diameter is, what their skin and tissue envelope looks like to determine what the appropriate implant is. And the critical piece in the consultation is some type of 3D imaging, such as Chrysalix or Vectra, where patients can actually view specific different implants and see what those different sizes and shapes will look like within their body. So a surgeon who's able to provide you specific capsular contracture data for the implants they use, as well as using some type of 3D imaging, is really going to eliminate a lot of the guesswork in that consultation up front. And that's what informed consent should look like. The difference is you go from just hoping your results are going to look the way you want to having a much higher level of assurance because you've seen it ahead of time. You also go from just having a generic risk to understanding what the specific risk is with the implants and the technique that is being chosen for you. So questions 3 and 4 looked at safety and sizing. The next two go somewhere a lot of women never think to ask in the consultation. Hey, take a minute, click the like button or subscribe. We've got new videos going up weekly. They're all built around the questions and information that actually are going to help change and optimize your outcomes in plastic surgery. So these next two questions we want to talk about are going to reveal whether you are likely to need an additional surgery down the road. So a lot of people think once you've booked your surgery and decided to move forward, you don't really need to think about any additional surgery unless something goes wrong or there's a complication down the road. But there's two really important variables that are always relevant before you book your breast augmentation. And they are, number one, whether you need a lift with your augmentation, and also how long the implants will last. Both are going to affect the total plan and the total cost of all procedures. And a lot of times they don't get discussed ahead of time in consultations. A lot of times patients who feel the most blindsided are never the ones who had a complication. They're the ones who walked in with a specific plan that was missing a piece that nobody bothered bringing up or talking about before they actually had surgery. Both of these variables can be surfaced before you book a procedure, and they should be discussed by your surgeon during your consultation. Sometimes, though, you have to ask ahead of time. So the fifth question, which is really critical, is, do I need a lift? And how are you going to help me understand what my results will look like with and without a lift? This is a really important question because patients don't want the scars. And obviously, if we could get great results without doing the lift, we would. But patients think they can just go bigger with an implant. But the reality is, if you need a lift, and it's going to give you a much better, durable, aesthetic result. Ptosis or drooping of the breast exists on a spectrum. You can have mild cases to really severe cases where the areolas are below the fold under your breast and they're at the bottom of your breast. No amount of implant is going to fix that. The right answer involves modeling what your results are going to look like with and without a lift for the patient. And seeing that before deciding on which is the right option for you. The surgeon just giving you a flat yes or no without being able to show you the difference is really kind of doing you a disservice. The sixth question, which is an important one that a lot of patients forget to ask or they're misinformed about, is how long will my implants last? Do I need to get them replaced? This old belief that you needed to get your implants changed every 10 years is based on older generation implants and incomplete data. Modern premium implants and the current sixth generation cohesive gel implants do not need to be replaced unless the patient is having a problem. There's no specific calendar date or 10 years that patients have to get these switched. Any surgeon who gives you a fixed decade timeline is probably either working from misinformation or old data. So the key shift here is stop making decisions just on a partial plan, understanding the realistic arc of what you're committing to and what's going to be necessary for you to achieve the kind of results that you want. So you now have 6 questions. The last 2 are different from everything that came before them. This is also where a lot of the most important information lives. So let's talk about how to read a surgeon's communication style and why that matters more than what their before and afters may show on the website. So asking the right technical questions about the procedure are important, but they're not the only thing. You also need to read and understand how your surgeon communicates. Let's talk about 2 specific questions that are going to help answer that for you. So traditionally, people thought that a good consultation just involved a knowledgeable surgeon with good technical ability, friendly staff, and they're going to give you a plan and a price for the procedure. You feel comfortable with that, and you like them both. So comfort and competence are related, but they're not the same thing. A surgeon can be pleasant, might be a nice guy, might be credentialed, but they can be completely generic in how they treat your case and kind of do the same thing for every patient rather than customizing their approach based on your specific anatomy and needs. So if they give you the same answer that they're going to give any other breast consultation that walks through your door, they haven't made a plan for you individually. They've just given you a template. So 2 questions are going to answer really quickly which type of consultation you're in. So question number 7 is, walk me through what you're actually recommending for me and why. So it's not a question of just the procedure itself. It's a request for a specific plan for your body and why that's different maybe than what they would choose for somebody else. This plan should include implant placement, what type of implant, how this is relevant to your anatomy, whether there's other considerations like whether you need a lift or not, and they should reflect back to you what your desires are that you were trying to achieve in the first place. If it's generic, you need to ask some follow-up questions. What about my anatomy specifically drove you to this recommendation? The last one is really important and unique, and a lot of patients don't ever bother to ask. It's pretty direct. What would you do if you were me? So this reveals how your surgeon actually thinks about this, not just presenting options. They should be able to give you a very direct, specific answer that's going to be transparent, and it shows that they are invested in your outcome. Oftentimes, I will tell patients, if you were my family member, if you were my wife or my friend, this is what I would choose for you. If they just deflect and say it's just up to you without going any further, that's going to tell you a lot. They're both valuable information and answers that are going to help guide you in what the right decision is for you. So we need to stop evaluating your surgeons just on how polished they feel and start evaluating them on the quality and process of how they think. Question 8 is going to help you separate those 2 every time. So now you have all 8 questions. The last thing is to put them in a form that you can actually use. So it's really important to understand a surgeon is only going to be able to give you information at the level of the questions that you ask. So the preparation you have before your appointment is really going to determine the quality of what that consultation looks like. So the example is, it's like going into a tailor with a photo of a suit rather than going in with exact measurements, what fabric you want, and a clear sense of how you want it to look. One produces a suit that fits, and the other is just a guess. A prepared patient is going to walk out with real clarity, what size, what it's going to look like, what the trade-offs are for various approaches, and that clarity is going to give them confidence. Confidence is going to ultimately produce satisfaction with their results. Tonight, take a screenshot and bring it to the consultation. Let's go over the different questions. Question 1, where do you plan to place the implant, and why is that the right choice for my anatomy? Number 2, What implant do you use and what is the complication rate for that specific brand of implants? 3, what's the capsular contracture rate with the implant and placement that you're recommending for me? 4, how do you actually determine the right implant and size? And can I see what that looks like in my body ahead of time? Question 5, do I need a lift? How will you help me understand what those results are going to look like with and without the lift? 6, how long do my implants last? Am I going to need to get them replaced? Question 7, walk me through exactly what you're recommending for me and why. And question 8, what would you do if it was you? So the first 4 questions are going to talk about the technical aspects and whether those are sound. The last 4, is this the right surgeon for you to execute the plan that you need? Strong answers to all 8 are going to give you a consultation that's worth moving forward with the surgery. If they're vague, rushed, generic, then that's going to give you important information and maybe you need to consider an additional consultation. So the final thoughts, breast augmentation consultation isn't a transaction. The consultation is the moment where the quality of your results get determined before anything else actually happens. The surgeon who actually takes the time to answer these 8 questions with specificity and confidence is going to tell you that they've actually thought about your outcomes and are invested in your results. And that's the standard that you should expect in any consultation that you go to. We've already got a lot of videos on this channel that cover exactly how to choose your implant size, break down that sizing system that a surgeon should use, why cup sizes are not a reliable target at all, and how to see the results on your own body before booking surgery.